Hello and welcome. I am Fern from Future Ahead, and today we are going to talk about cognitive behavioural therapy. So, this is one of the most widely used forms of therapy across the UK. So, let's get stuck in. So, what exactly is CBT? Well, the aims of CBT is to reframe different thinking patterns and behaviours in order to form new and healthier cognitions and behavioural changes. So, in this, you'll see often therapists will use such like homework sheets or just worksheets in general. Essentially, it aims to make the patient their own therapist. So in CBT, they will acquire a lot of skills, and the idea is that they can return to these worksheets in the future should they need them. So, who exactly is CBT for? Well, it's for those experiencing from anxiety or depression or undergoing stress or bereavement. CBT can actually be applied to a lot of things, but with more complex mental health disorders, you're not going to find it necessarily alleviates all of the symptoms and they may have more complex needs. So, CBT is not going to work on its own. However, often therapists will apply CBT methods as well as a few other therapies. So, who shouldn't use CBT? Well, a lot of people go to therapy because they sort of want to dissect trauma that's happened to them in the past or even a recent trauma. Maybe they have complex PTSD. If they want to dissect and look at past events, CBT generally isn't the best thing for them. They may find it invalidating because we're trying to focus our awareness away from the experience and onto what we can do, what we can do in the future, and what we can control and how we can manage our core belief system in order to live a more fulfilling lifestyle. That being said, I'm not saying anybody with PTSD shouldn't get CBT. It's just may not be the best thing for certain people with PTSD. It could help in the case where someone wants to move away from the trauma and focus on what they can do next, but they may require a different type of therapy where they can sort of process that trauma in order to move on, which is often why we use things like EMDR or even person centered therapy can be good for people with PTSD. So, this is why I say we shouldn't necessarily write off CBT if somebody has PTSD because it can be beneficial. It's just not for everybody with complex needs. So, first of all, we're going to look at our core beliefs. Basically, the way that the world, the self, and our future works is it all works in a little triangle. So, if we have negative views in one area, it's going to inform our experiences in the world, and that's going to inform our future. And when we have a negative experience of the world and we then continue having negative experiences, um, we then feel negatively about ourselves. So we can sort of see that this is a pattern, it's a cycle. And when we evaluate these core beliefs and we realize, okay, well, I can change my experiences of the world, I can inform my own future, and I can inform my own views about myself, then we can begin to live a positive lifestyle. So, when we identify our core beliefs, the therapist might ask us to then write down some positive beliefs, and we can see how if we believe in these positive beliefs, or if we change our mindset, how this will inform the rest of our life. And so when we weigh up our negative beliefs against a conflicting positive belief, we can inspire change and develop a different thinking pattern. So the therapist may give the patient a worksheet on thinking errors. Thinking errors are also known as cognitive distortions, and this is any way of thinking about a situation where it's irrational. So there's a lot of different types of thinking errors. I've listed three here. One of them is catastrophizing. So this is amplifying an issue and deciding the worst might happen. So that's if we're looking at a situation in the future, but we may have looked at a situation in the past and said, Okay, I acted in this way, maybe this means that so and so hates me. That would be another view of catastrophizing. Uh, Personalization, so we had a comment and we made it about us. Shoulds. So shoulds are very applicable to PTSD situations. So I should have reacted in this way. I'm even in relationship situations. Um, Regret, oh, I should have done this. But then when we think about how we can evaluate the situation, we realize we can't change the situation, and so there's no way we should be stuck up on shoulds because we're only going to torture ourselves. Now, speaking of things that we can't control, another worksheet that the therapist may give out is all about circles of control. So, through understanding what we can and can't control in the world and what we can influence, however, don't have a direct control over the result, we can then relinquish any guilt. We can stop ourselves from worrying about certain things. We can generally just let go of things that are outside of our control and feel a little less concerned, guilty, worried about those areas. And then when we focus on areas that we can control, we can then take a bit more responsibility for those areas and create positive change as we take control of those areas. Focusing on another type of worksheet that might be given out, this kind of links back to those core beliefs once again. So, what the therapist is going to do is have the patient list out some statements that they believe. Or in another type of worksheet, remember there's a lot of different worksheets, templates that can be handed out. They may present them with a list of already formed statements, and the patient will list which ones they agree with and how true those statements are. They will then be asked if these statements are a matter of fact or opinion. And then, when they realize how many of these statements are actually opinions, they can realize they do not have control over those opinions. Or that if somebody has formed an opinion, it doesn't necessarily need to be something that matters to them, as they could say, well, maybe it's an unfair opinion, and opinions of particular groups do not matter to the patient, as we cannot satisfy everyone. So, once they decide which statements they would actually like to give attention to, they feel some stress is relieved and they are now able to cope more. Thank you for listening today. I hope you enjoyed this mini lecture on cognitive behavioural therapy. And go ahead and like and subscribe if you would like to see more approaches to therapy and more information on psychology. Thank you.